Hi, we are Team One Piece. We are a group of computer science students at INTI International College Subang. Today we are presenting our solution in combating the coronavirus disease.
Hi, my name is Jane. So I'll be talking about the problem statement. So currently, to those who want to take a coronavirus diagnostics test will find it troublesome and inconvenient because the test takes at least 1 day to process, hence wasting the time, petrol, and money. This is a problem as there is a lack of a mobile app screening test tool that user can take at their own discretion.
Okay, my name is Kelvin. I'll be talking about introduction. As of March 25th, 2020, 414,000 cases and 18,000 deaths due to the coronavirus disease have been reported worldwide. Although vaccine trials are currently on the way, there is yet to be a vaccine developed for the disease. Therefore, as a result of this, the WHO has expressed concern over these figures and urged all the country national government to conduct persistent testing. Although testing does provide many benefits, there are still many individuals that are reluctant to be tested due to factors such as lingering sense of scarcity, lack of access in the rural area, concern about cost, and etc. Hence, there is a need in the market for a mobile app screen test that the user can screen themselves at their own discretion. In terms of our solution, we are proposing to build a mobile application that can provide a smart and accessible coronavirus 2019 screening test. The test will consist of components such as a pre-existing screening test questionnaire whereby each of these questions are used to evaluate the user overall health status. A question will also be asked to determine if the user have any past medical history of respiratory illness such as asthma. Then the user would be required to use the iris scanner functionality whereby users are to use their smartphone camera to scan and take a photo of their eyes. The photo will then be feed into our Google API, machine learning and artificial intelligence API to screen for any ophthalmological sign indicating of a possible coronavirus infection. In terms of the heart rate is measured by analyzing changes to the color of the user fingertip. The user can do this through the smartphone camera and flash. While for the breathing pattern, in order to measure the breathing rate, the user must place their finger on the screen and breathe in until the yellow line covering the circle disappears and then breathe out to measure their breathing pattern. After the recording is complete, the result will be evaluated to determine the user heart rate and breathing pattern will be normal or abnormal in nature. The app will then display the user infectious level risk as well as the user overall health status. The app will then provide the user an option to seek further medical attention by booking a medical appointment or having the option to book for coronavirus 2019 diagnostic test service packages or even both.
Hi, my name is Ahmed. I'll be presenting to you the storyboard. So let's say a user, I'll give this user a name, Mr. Vincent. He's working in his office and he seems to have diseases, he seems to have symptoms of coronavirus such as cough, flu, and etc. So one of his colleagues just stumbled upon and then talked to him regarding how he was feeling because she saw that his eyes were red as well. So after talking to her, he felt that he need to go for coronavirus screening test because the disease has been on rise recently. Therefore, before he went to the hospital to conduct the test, because costly and all, he wanted to be sure that that's the disease that he has. So to ensure that, just to find out, do a simple checkup, he tried to search online for an app that would conduct the screening test for him. So he stumbled upon our app. It is at the App Store. So he downloaded the app and then he started to screen the test for coronavirus. First, he had to fill up some questionnaire. So after he filled up his questionnaire, he scanned his eye, he took a picture, and then he sent to the Google API for processing. After that, he went and placed his finger on the app to check the breathing and the heart rate. After that, the results will be shown to indicate whether he has high infectious level risk and his overall health status. If the infectious rate is high, he will be warned through the app with the if let's say the report indicates that he has a high coronavirus level, he can conduct a booking appointment, and he can post book appointment to do the coronavirus test. After that, after he complete his transaction, he can go and go to the nearest Roche hospital for the appointment.
Hi, I'm Alicia and I'll be talking about the outcome, benefits and the technologies used. So for the benefits, the user can perform the screening test at their own discretion. This will help users who are busy, like we've seen in our storyboard. And the healthcare workers will be able to anticipate highly infectious individuals that are arriving for medical healthcare, because through the app you can book your screening test. We can also provide the platform for users to book medical consultations and to book coronavirus tests. Other than that, the user can also evaluate their infectious levels and determine their level of need for medical interventions. For the technologies that we will be using Ionic, which is a hybrid mobile development, which will be able to be used for both Android and iOS, and we'll be using Angular as the front-end framework for our mobile application.
Now I'll talk about the outline of proposal. In here you can see our project details, which consists of the project name, the project manager, the project start date, which is on the 1st 10 2020, and we're expected to be completed on the 31st 10 2020. In terms of the project description, we are building a mobile-based application coronavirus 2019 screening test that allows the user to evaluate their overall health status as well as their infectious level risk to the coronavirus disease at their own discretion. The app will be based on components such as the pre-existing screening questionnaire, the iris scanner functionality, as well as the app measuring heart rate and breathing rate functionality. The project objective is to create a digitized mobile version of the pre-existing screening questionnaire along with its scoring system. We also will create and train the app iris scanner functionality to recognize any possible ophthalmological signs that could indicate the possibility of a coronavirus infection. We will also create a mobile app functionality that measures the user heart rate and the user breathing rate, as well as determine whether the user heart rate is normal or abnormal and the user breathing rate is normal or abnormal. In terms of the project cost, the project development will not incur any cost, as the technology used to build this prototype is free of any service charge. That's all today for our presentation. Thank you very much for listening.